Well, if you suffer from frequent headaches, the problem could be with your jaw. Dr. Stan Farrell joins me today, and he is here to talk about TMJ, which I know a lot of people probably have TMJ, and they have no idea that they have it. Welcome to the show.
Yeah, thank you.
When should patients come and see you?
Well, you know, it's interesting because a lot of people I run into all the time, they're walking around with jaw pain, headaches, and they're just suffering because they've seen so many doctors and nobody's been able to really, help them get rid of the pain, so they just go about suffering with it. So a lot of the patients that I do see are people of this nature who've just been putting up with it for a while, and then they find out that, in fact, somebody like myself is actually able to help them with the problem.
Right, relieve
exactly.
their pain.
Yeah.
What is the difference actually between you and a regular dentist?
Well, most dentists, they're trained to treat TMJ and headaches and things of this nature by changing a person's bite. But what we do is we actually look at the nerves, the muscle, the joint.
And we're seeing that in the picture right here.
Yeah,
you can see all the muscles.
Yeah, and it's more from a medical standpoint. We're looking at this picture right here of the muscles, and you can see the joint right there. So we're focusing on these because a lot of the times it's either a combination or it's one of these things right here. And here we can see the joint with the disc right there. And sometimes people have dislocated discs or arthritis there, and they have bad muscle spasms or muscle tears even.
Right.
And you need to address those, not just the teeth and how the teeth come together.
Right. I know I was asking you some questions earlier too. You can treat headaches differently. How do you do that?
Well, the headaches are treated differently. If we look at this other picture over here, that might depict it. There's an area in the brain called the trigeminal nucleus caudalis, and that area is kind of the relay center for pain in the head and neck. And so if you have things feeding into that, such as jaw pain, muscle pain, things of that nature, you're going to trigger more migraines and headaches, because that's the same area where the migraines are triggered.
Right.
So we just want to cut down on the input to those areas, and then ultimately less headaches.
And a lot of times it sounds like it's a simple procedure. You have something right here that I was a little curious about.
Yeah, this right here, we do use splints to take the pressure off the joints and also the muscles so that things feel better and work better.
So if someone would wear this, when would they wear it?
Well, this one is a special type. This is a type of splint that somebody can actually eat with.
Okay.
So if somebody is comfortable with a regular appliance, and they take it out and they go to eat and they're having a lot of pain, this is something that they could wear while they're eating and not have any pain.
Because it just helps wherever your jaw lands, when it,
well, exactly.
it sort of
and when you're putting pressure, so when you're closing down and putting pressure,
right?
Okay, what's happening over here in the joint? What's happening, in the muscles? What's happening? And this is what takes a lot of the shock and pressure off those areas.
Great. Well, thank you very much. I mean, obviously, if you have headaches, there's a lot that you can find out, and you can relieve the pain. And you can do that by reaching out to AZ Headache, AZ TMJ, by calling 480-945-3629 or online at azheadache.com or aztmj.com. AZ Headache and AZ TMJ are sponsors of Sonoran Living Live.